Okay, thank you very much. Good afternoon, everybody. Marian, I saw you earlier. Samuel, how are you?
I'm good, thank you.
Yes, we have, I'm not seeing the other panel members. I'm seeing new people. Karen was not on my list. Is he on my list now?
You have your panelists and additional people, David. Just go for it.
All right, I go for it. Good. Okay. The purpose of this session is really for the panelists to reflect on what we said in different sessions this morning and be a little more provocative in terms of how do we take it from here? What are the long-term issues we need to do? Are there recommendations you want to propose on how we handle what we did in the various groups we were in this morning? And really, it's a time for pulling everything together. So I'm delighted to chair this session and to see how we build a case for all the things we talked about, the partnership, looking after our healthcare workers in a situation of COVID. COVID is still here, and our healthcare workers are probably having a lot of problems. They are not getting enough support. Also, we don't have skills to look after ourselves and so on. In some of our cases, we have very little support from the management where we work. The infrastructure is not adequate and so on. So please help me to build a case on how we move forward on this matter. And perhaps, I don't know who wants to start. Do you have a volunteer to reflect? Because I'm told more people have joined. Otherwise, on my list, I had Omiema, I had Professor Marian, I had Wilson, I had Samuel. Who wants to go first? Marian, you want to start?
Thank you, David. Yes, I shall start. And we start with compassion because it's the hardest thing. We can't start to build compassion through PowerPoint slides and just conferences. We need to start to build compassion for ourselves and our colleagues through bravery. And it takes a brave step to step out of the uniform, step out of the strength identity as a clinician and say, we need something for us too, because without a system that supports us to regenerate our compassion, we won't have anything left for our patients either. This links to the quality of care that we can offer. So much of the conversations throughout the conference today have shown how difficult it is for us to stop and put that compassion to ourselves and recognize that we need to put it to our colleagues as well. And I think building a case for a compassionate culture builds, therefore, from the beginning for us to recognize the growth that has come from this experience as well, the mindset that we can learn from this, and recognize that people who have cared for people living with COVID say, I would do that again with my colleagues, with these people who I've done it with in this space that I've done it with, recognizing some of the limitations that have gone on. And so we have a strength of character and a strength of compassion that's there that needs to somehow be supported through the way that we design our systems and through the way that our society recognizes us, not as heroes and not as somebody who will go into the fire again, but as people who are safety critical and who have skills that can manage future shocks and pandemics. And we need to be able to teach our next generations about how to be compassionate to ourselves and our colleagues as well as our patients, and build in that sense of worth and self-esteem that it's okay to care for you too. Hopefully we've shown that through the process that we've gone through now by raising it to address the stigma that's there when we try and talk about self-compassion, stigma that says, oh no, I need to just keep going. We've put it right to the fore of this conference, and it's hard to stop that doing it all for the patients and our and our families, and say, actually I need to start doing something to replenish myself too. hopefully this process has helped do that. Thank you.
Very good. I was in your session, of course, and it's good. We have emphasized the importance of compassion. Perhaps it's the starting point. If we could get compassion right, maybe other things will fall into place. Well done. Samuel.
Thank you. And I will start with a little report of the session we were in. So we were talking about partnerships and how the pandemic has affected partnerships. And I think one of the key outcomes was the importance of digital tools, but also the limitations of digital tools to support partnerships and to support training. So I think we talked a lot about how digital tools could help to measure impact of a pandemic, to allocate resources, to allocate health worker resources, to find ways to address the challenges that the pandemic has posed on and has put on the health workers. We talked about tools and ways to improve the training, health worker training, nursing, and doctors remotely with e-simulation, with e-training, but also the challenges that these new sort and ways of training bring. And we talked about the limitations of digital tools to create trust and to create a true partnership. And maybe this is a learning process that we will all go through and that we currently all have gone through for a year now. That the challenge of the same depth of partnership to create this over digital tools, and then the challenges as well to leave no one behind. When you have to move, when you have to distance, when you have to move trainings into a digital sphere, into virtual trainings, how can we make sure that also remote areas get the training needed and where it's urgently needed, and how can we make sure that like being connected is not absolutely defining who's able to receive training and who's able to participate. So I think one of the key learnings that was really interesting to see the polls we created in this session, that 44% of the participants said that they would substantially reduce travel and change the way partnerships will work, even if after COVID is gone. And I clicked the same, but I must say that also with the discussion we had, I see that if we want to make this a success, and there are big advantages and opportunities with new tools and also learning from this experience, from this COVID pandemic experience, and some things will get better, but I think we have to make sure first that no one's left behind, that we take the best things we've learned, but don't forget about the good things we had before the pandemic and that work to build trust and to build partnership.
Wow, Samuel, this is easier said than done. Of course, digital platforms are now the in thing, and COVID really helped us to take advantage of it. And if we could use that to train people, if we could use that to communicate better and less travel, as you put it, that would be great. So that's a good lesson to take forward. Well done. Well done indeed. You really brought up some important issues we need to take care of. I'm told Joe, are you online?
Yes, David, I'm here.
Please go ahead.
So thanks very much. Thank you. So our session was about knowledge exchange and what partnerships are looking forward to in the next 12 months. So it was nice to look beyond COVID. Similar to Samuel, Antia highlighted that the virtual world had become a reality for us all, whether we are partnerships between Ireland and Africa or even within Ireland. We're all virtual at the moment, but there's a huge diversity of technology and tools, and we need to develop the evidence base about what works and what doesn't work. And as Samuel highlighted, that some people were left behind, and in her university, it became apparent very quickly in that move to online learning that some people didn't have access to devices or to connectivity. Sandra highlighted that even within partnerships, we talk about a lot about the people who are left behind being outside the partnership, but even within partnerships, we may have members of staff who are not thought of. And she really highlighted a really innovative program for porters in Gondar, teaching them about infection control and how important that was. And I really like she discussed about how both health and partnerships are complex adaptive systems that are unpredictable, and often the outcomes are unknowable, a bit like what COVID-19 was. how we'd all adapted very well to that, and maybe taking some of that forward into the future of not having to be right all the time, and sometimes it's okay to be wrong, but it's very important to know that we're wrong as well and learn from those, not to see something being wrong as a failure. And then Sonny from the World Health Organization highlighted the Health Learning Hub, which I think is a really exciting development where we can share those experiences, both the good and the bad, about what has happened during this, and learn about health services for the future, how we can build back better, and across the world, what has worked in both the global north and the global south during COVID-19 and what hasn't worked. And it looks like a really innovative platform that will be easy to use and easy to access for people. So really fascinating session at our end.
Wow, there is another dimension, sharing experiences, learning from what we have done, and also what worked, what did not work, our mistakes. That's all part of learning. I agree with you. And really, I think if there's anything to take forward is how do we share our experiences based on what we've learned through this exercise. So I think that's a major lesson, and it's being recorded, and I hope we can get all the lessons we have learned recorded and shared across our networks. Very good, well said. Next, Wilson. Is Wilson around? Charlotte, who is the next speaker?
Oh, yes, I'm around.
Okay,
thank you very much.
Yes, Wilson Buliwanji.
Advocacy stream. Bwino mulibwanji, mwadiera.
Go ahead, please.
Okay, great. Thank you very much. Yeah, so in the advocacy stream, I think basically there was the emphasis on the role that the healthcare workers play in influencing change, and also in overcoming things like maybe the views that are coming through social media and other platforms, and also influencing even the national policy as well as stigma. So I think the healthcare worker is quite essential and central because they are unique in the sense that they experience COVID in so many fronts. I mean, they see the patients themselves. Have seen colleagues acquire the disease, and they're also involved, their families, and much more also, I think they're also perceived as a hope for the nation, okay? And having said that, I think they are quite important for them to be able to influence change and be the advocacy. There's also need to understand and appreciate that amidst, even when this COVID came through, they were also associated with anxiety, fears, and different aspects. And that's why it's essential, I think, the training, the skills development, and also even the environment also matters. I mean, the confidence that we have for them to influence change, they need to have the right environment, they have to have the right PPEs. And I think with that, I think they are quite central, and they can make a necessary change that is needed. So I think in a nutshell, I think that's what is quite central as far as the healthcare workers are concerned in advocating for change. Thank you.
Okay, we brought an important point which was also discussed in our session: the environment in which we work. It can be demotivating. It can also elevate people if it's properly handled. And this may be a management issue. We need to create the right environment for health workers to work without much impedance. So I totally agree with you. Thank you. Training is important, improving skills, completely, you're right. We have covered the four of you, but there are some comments in the chat. I don't know if you have seen them. We may need to, no, I think they're not important. But anybody else listening to what we are saying, anybody else with comments? I think we are wrapping up before the main conclusion. Anybody else wants to have comments on how do we take this forward? I think the various lessons have come out very clear, and they're being recorded. Anybody wants to reflect further, even across areas where you were not? Any reflection?
Hi.
Yes.
Yeah, this is Eunice from Zambia,
Yes.
country director for THET Zambia.
Eunice,
Just a few comments
Yes.
and lessons and things that I've picked out of the conference throughout the day. It's very interesting to see how programs, partners have become so resilient to the pandemic, and how they've very quickly adapted their way of working to ensure they are responding to COVID. It's the way projects have changed, and they've changed the way they've worked, and it's very interesting to learn from our colleagues from Madagascar how they've adapted the use of TAP, which is technology assisted partnerships, to work with the partners. So that has been really very interesting, and I think it's something that we can all start thinking about. One thing that I have one thing that I have noted that hasn't been talked a lot about is the community involvement in the issue of COVID. I think I haven't, maybe some other sessions that I have not attended, but most sessions that I've attended have not actually responded to, have not actually talked a lot about community involvement. That's the only take that I can say.
Very good. Well spoken. Is there anybody else who wants to make comments on what we had? If not, I'm not going to release you easily. I would like each one of you, Marion, Joe, Wilson, Samuel, one take-home forward action. Just one take-home forward action. One at a time. Starting with Marion. If yes was one thing you could say, I want to take home this message, what would that be? One.
It's hard to be compassionate to yourself and your colleagues. It's harder than to patients, but if you're not, who else is going to be?
Wow. Someone, one take-home message and take forward action point.
Learn how to build trust in the virtual world. That is, I think, what we need to do.
All right, Wilson.
Yeah, I think let's invest in the healthcare worker, and I think they'll make the necessary change that we need to see across all fronts. Thank you.
We are not investing enough in the healthcare worker. That's what you are saying. We need to invest more.
Yes, I think we need to invest more.
All right.
Yes, in terms of the skill, and yeah, and I think they'll drive the change.
Very good. And Joe, finally, Joe, one take-home message.
Oh, I think it's to take that risk-taking behavior we had during COVID-19 and our partnerships to explore things in the future, and don't afraid to be wrong, but make sure you measure things so that you know that if you're wrong, you don't make the same mistake again.
Wow. I deliberately brought you back because we need to record action points. We need to record the main messages from your contributions. And I want to thank you. This was a very well thought through summary of what we have had in our various groups. I think if there are no other comments, I don't know, do you have any other comments, general comments? We still have a few minutes. Anybody wants to make other comments? None. So I thank the panelists on behalf of the organizers. I was glad to take charge of this session, and I want to put it back to the organizers. We've closed the session now. Thank you very much.
Okay, David, thank you. And thank you to everyone who contributed to that panel. Let's take 5 minutes break, and then we're going to return for the final panel discussion of the afternoon of the conference, which will involve Dr. Shams Said. Thank you, Shams, for staying with us. Eunice Nyemu, who we just heard from Zambia, Dr. David Weekliam from Ireland, and Sarah Kavanagh from the UK. So we'll return and we'll have a final session, which is priorities for action. And then the climax and the finale of the conference will be given by Professor Francis Amazwa, who will give the final keynote speech. So see you all at 45 past the hour, and thank you.
Then we're having a challenge with the computer here. Professor Marshall has moved here with me now. If you just give us the right Zoom link, send the email to him.
Thank you, David.
Okay.
Thank you, everyone. Bye.
Yeah.
Okay, welcome back everyone, and thank you for bearing with us. We're reaching the climax of the conference, and it's great that you've stayed this long. At the beginning of the conference, I mentioned the statistics. I mean, goodness me, we've seen over 2.5 million deaths. The stakes couldn't be higher, and there is this sense that there is more to come. Until we have vaccinations rolled out effectively for every person in the world, there will be the risk that people will die, and there will be the risk that this relentless pressure on health workers will continue. Last year, when we organized our COVID Partnerships conference, we produced a learning paper as a result of that conference, which was the basis for advocacy and it influenced our grant making. So I'm really delighted that we're now focusing on thinking across the conference as a whole, and trying to now identify what the priorities for actions are, because this conversation will help us write the document that will influence the shape of our advocacy and of our grant making to come. So please join me in welcoming Shams, Eunice, David, and Sarah. And we're gonna divide the conversation into two sections. The first section is just to reflect on the conference we've just had, and to ask what for you has been the most interesting aspects of the health partnership response to COVID-19. And then in the second section, I'm going to invite you all to think about what messages do we want to share with the donor community and beyond? What for you are the most important priorities for action that we should be identifying that should guide our work in the future? So reflecting on the conference we've just had, can I start with you, Shams, and hear you say a few words, please?
Thanks very much, Ben, and really very interesting to hear so many different perspectives across the different sections. And I've had the pleasure of dipping in and out of a number of them. A couple of things that really jumped out at me was we have a huge amount of wisdom within the partnership community on how to tilt institutional health partnerships towards the realities that we are facing at this point. So that wisdom, it made me think that needs to be captured in terms of how we tilt and how we design future institutional health partnerships. The second piece that really jumped out at me was how institutional health partnerships are already contributing to national efforts. And it came across in different ways, but perhaps institutional health partnerships may not be taking as much credit as they could in the work that they're doing to support national efforts in the various countries that, that institutional health partnerships are involved in. And then the third big piece that was coming out for me was related to the area of compassion and the necessity to examine what that means for people in real terms, and also to develop further conceptual clarity on the concept of compassion, given that there is a huge body of knowledge and evidence related to the effects of compassion on delivering high quality healthcare. And secondly, the importance of the word in protecting health workers. That came out loud and clear. The word has power, and it can be used to help us protect health workers from the various challenges that they face, including some severe challenges related to violence, both physical and verbal. controversial perhaps, but that was coming out loud and clear to me. Ben.
Thank you so much. And when you say tilt partnerships, you're not just talking about responding to COVID, are you? But you're talking about the way we organize partnerships, the points you were making earlier about the dynamics of power within partnerships.
That's exactly right. So there's, for me, there would be multiple parts of that tilt equation. Some of that is actually how we do partnerships, but some of it is also tilting towards subject matters that have immediate relevance and urgency. So there are many examples of that, but the one that you're highlighting at the moment is such an important area, vaccine rollout. So institutional health partnerships. How can institutional health partnerships support those efforts in a coordinated and effective way? So there's multiple aspects to that tilt, but that's those are the ingredients that I think we've heard of today, Ben.
And thank you for highlighting compassion. I mean, you've designed that part of this program with Marion Lynch, and it's been a fantastic aspect of this conference. You've really lifted it onto our agenda. Thank you, Shams. And we really want to rally around that theme, which is so important. And so important, as you say, because of the connection with mental health and mental well-being, and because of the pressures that are on health workers at the moment. Thank you, Shams. Can I turn to Eunice? Eunice, what are your, just thinking back over the conference we've had, what are the most interesting aspects that you feel we've identified?
Oh, hi, Ben. Can you hear me? Yeah. I think building on what Shams has already said, the issue of mental health, and this is really key to me because I've seen it firsthand in some of the health facilities I've visited in Zambia, where a lot of healthcare workers have got issues to do with mental health, the fear of coming to work because they're scared of either passing on the infection, the virus, or catching the virus. In some cases in Zambia, at least some of the health facilities we have visited, we've had cases of people committing suicide because they've seen firsthand treating their loved ones, seeing their loved ones struggling to breathe without being assisted with oxygen, not because there's no one to assist, but because there's no oxygen supply. So for me, I think if I have to say on this one, the way forward is perhaps we need to prioritize mental health of frontier healthcare workers because it is impacting on a number of issues, including people not coming for work. So that for me has really come out. But the other thing that I've picked from here is the follow-on care. And perhaps this can be even go out further than COVID. What happens when after people have had COVID and they've gone back to the community, who follows to make sure, one, they are not exposing to themselves to other maybe diseases, but also who makes a follow-up to make sure the stigma which surrounds COVID. And I must say in Zambia, stigma on COVID is far higher, I think, than it was on HIV, because the moment either a household is heard to say there's someone who has had COVID, people stop visiting, people stop their children mixing, people stop doing anything, even taking some food stamps. That household becomes a no-go area. So for me, is who makes sure these follow-ups are done and who makes sure that the community out there is also sensitized in terms of information about COVID. And talking about information, I think one of the things again that I picked is the equitable access to information on COVID. Are we getting the same information with everybody else the way we are supposed to be getting information? The other thing, perhaps the last bit, is the issue of trust among partnerships. That has been talked a little bit to say, no, there has to be trust, which really resonates with the document that we have as FET, mutual trust. So all that for me came out quite strongly, and the use of technology and how programs have had to adapt. They've had to change very quickly. For example, the Lusaka College of Nursing, they've had to change very quickly on the way they deliver the program, despite having challenges with the connectivity and other things. So I'll pause for now.
Thank you. And that's an enormously rich amount that you've got out of the conference. Thank you. I have to say that when in January, you first talked to me and to other THEC colleagues about suicide rates in Zambian nurses, that was one of the wake-up calls that led to us organizing this conference and led to us saying to ourselves, we've got to think afresh, we have got to think again about how we can offer each other support. And for you to say, because I know you have a background in campaigning on HIV issues, for you to say that stigma related to COVID is higher than that related to HIV is a very sobering thought. And it connects with the thought you were saying about information, access to information. I'm very struck by Professor Amazwa talking about the problems with misinformation. So thank you very much. That was very rich. David, can I turn to you, please?
Yes, thanks, Ben. After one of the presentations earlier, I heard the facilitator talk about how inspired she was, and I thought that's, for me, sums up perhaps an overall reaction to the conference. I think it's been very inspiring, and a year on, I think we've got more time. I think more learning and more powerful lessons are coming through, and quite a number of things struck me in the different sessions. We've talked a lot about solidarity, the need for solidarity, and I thought this conference to me spoke so much about how that has happened in practice. And despite all the immediate challenges that we all face in our own countries with COVID-19, the partnerships have continued. And we saw in the synthesis report how 82% said they felt the partnerships continued to be valuable. And that to me reflected the quality of the partnerships, the quality of the relationships, and a really strong foundation to build on as we go forward. And we saw activities kept going. I mean, over the last year, we've heard so much about how services have been disrupted. All I heard today was about how services continued and were developed and were improved. And I think this is the tilting maybe that Shams talked about. And that speaks of resilience, and it speaks of readiness to act. And we heard Joe Gallagher talking about like not being afraid to make mistakes. It was important to act and act we did. And I think that was very powerful again. And I think it just shows what is possible even in challenging times. And then there was the rapidity of change. We're all in the business of strengthening health services and health systems, and we say, oh, it takes a long time to bring about change. We've seen some remarkable effective change over the past year. And I think we just should take great encouragement from that. Change can happen for the better quickly. And we've really got a lesson, I think, on that. And then I think we saw lots of examples of power shifts. Of course, there had to be power shifts because we couldn't travel. And to hear examples of just how positive that has been in many cases, to see examples of co-development in responding to challenges, of local initiative. I think we heard presentations, case studies, talking about engagement of staff, engaging with staff, engaging with communities. And so just to see that empowering going on at the local level in health services and communities, I mean, that's such a good development that we really need to not lose the benefit of and really need to take forward. And then just the issue of new projects. Now, I always had this with when you work in a partnership and a new project comes up, you think, well, we have to have exchange visits and go out and meet the stakeholders and do a situation analysis and gather lots of information. Well, actually, in the last year, we had to start projects without being able to do that. And that, I think, is a challenge just to think about how we can work in the future. Because what it meant was that the local partner was very firmly in charge. They had the information, they were very much taking the lead, and we had to have more trust in their leadership and their local decision making, because we weren't in a position to sometimes to find out all that ourselves. And I think that was very healthy. And I think that helped in addressing sometimes kind of the right power balance that we should be trying to achieve in partnerships. And then just without elaborating, just the final thing is, like others, the spotlight on compassion, that has just been so good, and really just helping us, just raising our awareness about this whole area of suffering and just the emotional resonance and all of, and having a way just to think about that and to see how we can, particularly with our health workers, to be more supportive of them. And I might come back to that in the actions later. Thanks.
Thank you, David, and thank you for all the thinking you do about health partnerships. It was important to act, and act we did. What a positive statement from you, and what a positive set of insights. Thank you. I hope people feel similarly empowered and pleased with what has been discussed at the conference, because it does, doesn't it, David? It does point to, as you say, that continued activity. Sarah, tilting, both David and Shams have mentioned tilting, and I sort of feel you're a tilt expert. So over to you.
Thanks, Ben. Wow, what an amazing day. It has been absolutely inspiring, and I totally echo what's been said already in this session. So a couple of reflections from me, really. Firstly, with tilting, with the partnerships, how they've done that in a couple of ways. Moving with agility, really, to pivot from whatever they were doing to respond to COVID. Being there, having the relationships already has been really, really helpful. Obviously, you wouldn't expect me not to mention the Commonwealth Partnerships, which I'll do briefly. In the presentation, the fantastic work we heard from Mbao and Fiona from the Lusaka Brighton Partnership. Not only did they pivot very, very rapidly when the need was there to benefit health workers in Zambia. This was done really just, I think, within a month. This training video was put together in the animation, which meant that health workers were protected. And if you're protecting the health workers, you're protecting the patients and the communities. And I think one thing, I don't know if it came out this morning actually, that this was bi-directional. This hand gel was also being manufactured in Sussex by the medical school, as these people who've been taught to do this by the Zambian colleagues. It absolutely phenomenal. But looking across all the partnerships, the ability to innovate, come up with ingenious ideas, it's just never ending, really. And yes, watch this space for the antimicrobial stewardship game we're currently developing with our partners. That's hopefully going to come. Oh, look, there's a picture of it. How exciting. Snakes and ladders, it's going to be really good. The second thing, and I know this has been touched on by everybody else, is compassion and well-being. And I think this might be one of the positives. There are some positives we can take from this pandemic. It's run through so many themes of today, and I commend the organisers and Shams for making this such high priority today. I'm sure I'm not alone in being really moved to tears by Dr. Saleo's film, not just for her personal loss, but also reflecting on the impact of health workers from Black, Asian and minority ethnic groups, some of whom are experiencing racism and stigmatization and all sorts of other challenges that just aren't there for other people. In my profession, I'm a pharmacist. We've just had our first national action plan for inclusivity in pharmacy practice launched actually only last week, which is really timely, reflecting on the inequalities that have really been brought to light by the pandemic. But this issue crosses all professional boundaries. So I think I think the fact that we're really focusing on mental health, well-being and compassion can only be a good thing. And perhaps, you know, as we kind of recover from this moving forwards, focusing on mental health in partnerships is going to become more of a need.
Yes, thank you, Sarah. And I thank you for reminding us of why we meet with humility, because the syndemic has exposed inequality in the UK, which was always there, as we know, but it's just shone a spotlight on it, and with it racism, and with it, you know, exceptional rates of death in BAME communities. And so thank you for reminding us that we need to be humble. And also with your reference to bi-directional learning. So we often talk about this, but my favorite example was a training program that Torbay used early in the epidemic, which was developed in Kenya, which I referenced in our BMJ article. So there is this exciting agenda where it genuinely is becoming bi-directional, where we genuinely need to learn with humility. Since I've got you, why don't we just switch or pivot or tilt onto the second question? And that's really, for you, what are the most important priorities for action that you think we should be articulating in the report that we produce from this? And if you could keep that to perhaps 1 or 2 points, that would be great.
Thanks, Ben. I thought I'd find this really easy, but every extra session that came up, I was thinking, oh, that's good. But trying to focus on just 2, I think my first priority would be we must work together across disciplines, across systems and boundaries. And these boundaries can be local, just between primary and secondary care, or across a region, or across a continent. We must support and develop each other and our workforce and lead with compassion and kindness. I think that is absolutely key, that there's no alternative to that. And then finally, I think I said I'd do 2, this is 3. Finally, at the risk of banging on about antimicrobial stewardship and AMR, antimicrobial resistance, my family say that's all I talk about. This pandemic is a wake-up call. AMR is a silent pandemic. It's a threat to global health security, and as a result is high on the agenda of our political leaders and our governments. But we've got time. We've got time to ramp up our efforts. We can use the momentum that's been generated by this pandemic to prevent the next one. We don't know when the next pandemic is coming, but we know the silent AMR pandemic is on its way. And we can do this by changing behaviour, and together coming up with innovative solutions to the problem, which don't need to be costly, and they will benefit all of us.
Thank you, Sarah. And that phrase, the silent pandemic, is so important, but so too is the point about, you know, we've seen 34 million people die of HIV/AIDS, for goodness sake, and yet the world was taken by surprise. This, you know, so the story goes on that the world's seemingly unable to learn the lessons of why we should be prioritizing global health, why it should be center stage. Let's hope that things are different this time. David, can I turn to you, please?
Thank you. Yeah, I've been busy turning my 5 priorities into 2 to keep you happy. I'll do my best, but I think, an overall thing is I think from this, partnerships are more important than ever. I think we've seen just so many examples of how partnerships have contributed way beyond COVID to health system strengthening and health services, and that needs to continue. So the issue of equity, what we can do about that, I think partnerships can lead on equity. COVID has been a great equalizer because it's exposed weaknesses in what are supposedly the strong health systems. We all have health system weaknesses. So in the rich countries, we're no longer the experts. And I think what we have through our health partnerships, given that as a principle, they're based on equality, is we can model what that equality is like by working in an equal way and really be promoters of that message of equality. And equality then in relation to resources. Now, that got me thinking, because about some of what was said about resources. Resources are critical, but in partnerships, we're always looking for resources. We don't have big access, so we think, well, that's somebody else's role. But actually what was said today was very helpful about that aid is not enough, and we need to also kind of confront the issue of rights, put rights at the center. why is it okay why is it not acceptable for someone in a highly rich country to not get the vaccine, but it's okay in a poor country? So I think for me, the action here is we can join in the advocacy at both national and international level for more equity on these issues, including not just the vaccine. And the focus on health workers, I think this is the year of the health and care worker. We really have to make this a priority area for action, and the whole theme of compassion here is very powerful. And when I think about the way we work in partnerships, we often think of the health workers as people we have these peer relationships with for training and education. It's about building capacity. And we sometimes forget about them as people working in jobs and their own personal experience of their lives and their work. And I think that's maybe a shift that we take out from this conference, that it's not just about training. It's about their employment and their work, their conditions of work, their safety, their mental well-being, about the kind of way they're supported supervision. So there's a lot there for us to work on, which I think will be a shift for us in working in partnership to really start getting into some of these areas. And then finally, just the issue of learning. We said a lot today about the need for better ways of learning. Let's have much more learning from south to north. I mean, I think the reciprocal learning, people have spoken about that. We've seen how resourceful some of the lower income countries have been during COVID-19. Let's try and capture learning. How have they done well when at times we've struggled? And how can we embed and bring some of that learning in a meaningful way into health systems in the higher income countries?
Fantastic.
Is that more than two?
I forgive you. Every one of them is gold dust. So thank you so much, David. And on the learning, sorry about this, but we slaved over it. THET developed a toolkit on innovation, and maybe someone can share the link. But it's getting conscious about the opportunities to learn, which means getting conscious about the unconscious bias that prevents us from learning. Those assumptions that we know more than they know, and I use that phrase deliberately. But thank you so much, David, for that set of insights. Eunice, over to you. What do you think our priorities should be in the report that we'll produce? You might be on mute, Eunice.
Yes. Good afternoon. How are you?
Eunice, are you with us? Have you? Oh, I think maybe we've just. Eunice, just finally.
I wasn't hearing it.
I'm just inviting you to think what our priority for action should be, and how we capture what priority should we capture in our report, and then I'll turn for final words to Shams before we conclude in about 2 minutes or so.
I think the priorities for us is to see how. I think the things that I've already spoken about earlier on, to see how we can support healthcare workers in their response, especially considering a presentation from, I think, Madagascar, not Madagascar, from, was it Sadia, who had said about 75% of NHS healthcare workers have been abused either physically or otherwise. Now, that is UK, but when you look at countries like Zambia, the abuse level is quite high. And perhaps these are the things which are contributing to some of the mental health issues that healthcare workers are facing. And there's no excuse for me, there's no excuse for abuse. But sometimes you can understand if you are seeing your loved one struggling and maybe the nurse is not doing anything, not because they don't want to do anything, it's because they have no means to help. That's where the abuse comes in. But for me, I think mental health should be prioritized, and I'll continue talking about this. I think mental health has to be a key priority for us.
Thank you. And I must say, I was with Howard Catton, who is obviously Chief Exec of ICN, and he was speaking very, very powerfully about the abuse that nurses are experiencing. And they've done some fantastic documentation of that. So thank you, Eunice. I'm sure you are correct. I'm going to turn finally to Shams before handing over to Claudia, who will close the conference with Francis Amazwa's keynote speech. Shams, over to you.
Yeah, thanks, Ben. And not unsurprisingly, agree with what Sarah, David, and Eunice have mentioned already. So it makes it easier perhaps for me. But I just perhaps have two suggestions that you've asked for. So the first one is how we within the institutional health partnership community can develop some form of guidance for the future institutional health partnerships. And what I mean by that is living experience of institutional health partnerships could really shape this. So the wisdom that already exists within the community, bringing it together and putting it down on paper could really be helpful in the entire in the cascade of the IHP thinking, and that would also, in my mind, allow us to articulate very clearly how the institutional health partnership work contributes to national strategic direction on a set of really important issues, whether that be quality health services, whether that be recovery. We could be looking at that, whether that should be vaccine rollout, preparedness for the future, AMR, there's so many. But with that, we have an opportunity to emphasize what institutional health partnerships can do. So that's one suggestion. And then the second suggestion is to think about everyday compassion. So what does everyday compassion mean for the institutional health partnership community? And really drawing from the science around compassion. There's now so much work that actually we could synthesize together, but it has to have meaning for those that are involved in institutional health partnerships. So it's applying the compassion lens, but with an institutional health partnership lens as well. And that, I feel, could be incredibly powerful. Ben.
Thank you so much, Shams. It's not on paper, but it's electronic, and it's called The Pulse. And I do hope that one of the things people have done during this conference is visit The Pulse, because I think that you talk about lived experience. I think that that can complement the published articles, if you like, the printed bits of paper, that if we can bring people together in those thoughtful zones within Pulse, that will help. Shams, thank you so much for 100 things, but also being with us throughout the day, for your opening keynote speech, as well as your contribution now and in the breakouts. Thank you. David, thank you very much for your role in organizing the conference as well as taking part. Sarah, thank you. And Eunice, thanks very much. I'll hand over now to Claudia and to Professor Amazwa.
Thank you very much. Can you hear me?
Yes, I can hear you.
Yeah. Professor, I think you were first, right? Would you like to start? Otherwise, I can start, as you prefer.
Maybe you start.
Okay, no problem. Yeah, thank you everyone for giving me the opportunity to close this great conference. I was thinking now, it is really great to participate in these meetings and to spend time in digital or in personal form with you. Because I mean, we always end up speaking about exactly the principles and reasons why I decided to work in health and in development cooperation, which is working together hand in hand with colleagues and experts from other countries and working for equity And I like very much how THET and how the Alliance and how our partners very much keep this in mind. So again, thank you for giving me this opportunity. Just a quick reminder that we will have the whole conference online, and it will be available very soon. And a big thanks to the organizing team. I'm really impressed by how perfectly everything worked and how sophisticated and innovative tools we've been using. I've never seen such a such a modern and functioning digital conference. I really have a very real conference feeling. And I could really feel the solidarity and the compassion and the humanity of our partnerships community. So yeah, I think a special gratitude and respect to all frontline health workers. And humbly, I think thanking you is not enough. I think you need more than thanks and then applauses. I think you guys need the engagement and the support by all the international community to make sure that every health worker has the safety conditions to work, receives the training they need, and are taken care of to be able to take care of all others. And finally, I would like to plead I will continue pleading to decision makers, and I will, as part of the health partnerships community, I will try to maintain the efforts and to make equal access to the vaccine and to universal healthcare real. So yeah, thank you.
Wow, thank you, Claudia, for those very pertinent and concise remarks. So finally, we are at the end of the meeting. And what do I have to say? I think the first thing is to say thank you. To say thank you to all the participants who have spared their time to be with us all day. And also to say a special thank you to THET, Ben and his team, to Esther, David, Claudia, and your teams, and of course also our group from Archest who have participated in some of the consultations prior to the meeting and in chairing some of the sessions. So that is the first point I really would like to make. And I also concur with you, Claudia. The technology has cooperated. There haven't been any major hitches all along. So back to the day, the title of our discussion today is called Partnerships in the Times of COVID. And COVID, our colleague Bernard from the German government described the impact of COVID as being an economic and a social crisis. He didn't say health, but in the end, it's been killing people. So now, partnerships, as we have discussed today, are really the future. We can't achieve anything without partnerships, starting with our humanity as people, as human beings. We are genetically, biologically partners. If you hear a sound outside, someone has been hit by a car, for example, you don't know the person, you feel sorry for that person. You don't celebrate that someone has been hit by a car. And it is this humanity of ours that has enabled us as human beings to master the planet and create things to our advantage. So that humanity is going to be something we look at as the driver of our partnerships. And then, of course, we live in a globalized world. And where really, the COVID started, they say in Wuhan, it is here in Uganda as well. How did it get here? And it is everywhere. So a problem in one corner of the world is a problem in all the world. So we really have no choice but to partner, take opportunities and threats which are there, and make sure that the world is a better place. And that's what the SDGs are about. That is what universal health coverage is about. And SDGs, they are interconnected, they are interdependent, and we have to work as partners through various sectors, through countries, to achieve this. So partnerships are a must. And there is, of course, the African proverb, which is being quoted so many times. If you want to go fast, you can go alone. But if you really want to go far, go together with other people. So partnerships is in. Let's build partnerships. Let's not move away or get shaken by anything, but strengthen the way we work together through partnerships. And the partnerships, we've been told through the meeting, have worked well. And they have been facilitated by the fourth industrial revolution with technology. People have not had to travel from place to place, and yet we have been able to make our partnerships work and to learn and actually to produce work. But above all, I think our discussion today and the preparation for the meeting has been about health workers, about the health workforce. We've talked about how technology enables it. We've talked about advocacy, compassion, well-being, and so on. And what struck me, or what strikes me, and together with my colleagues at Chest here as we've been listening to the meeting, is that while we are brought up as health workers to care about other people, we are not brought up to care about ourselves. We assume that those we serve will care for us. In the Hippocratic Oath, there is only one clause where it tells you to care for your teacher. But there is nowhere where it says either your teacher should care for you or you should care for each other. So this is the time now to change. This is the year of the health worker and social care workers. Let's not let it pass without something changing, something big happening to take us to a new direction in which we organize ourselves as health workers to serve the people. It is about the people. It's not about us. But we can't serve the people if we are not given the support that we need. We are not given the incentives that we need and the environment that we need. But it is going to be us to push for this new environment that we are talking about. And for this, I would say 3 actions. I've listened to those actions which Ben asked the 4 of you at the concluders to give, and I had already thought about some, and they fit in somewhere along the way. But to simplify, I think number 1, let's build leadership between ourselves. You know, when we convened the first Global Forum on Human Resources for Health, it was here in Kampala. There are 6 pillars of the Kampala Declaration and Agenda for Action. And the first pillar is building leadership for health workforce. There is a gap here. We need to do something about building leadership at national level, at subnational level, at community level. We have to organize ourselves so that we are in touch with the communities. That triangle which moves mountains, which calls for us to learn what issues the communities have and how to help them to solve them, so that we go to politicians and they just do what we tell them to do. So I would like to call upon the big groups here. Howard Carton, you are here, ICN, and then the World Medical Association. Let's get them together. And my friend David Wickham, you are the president or the chair of the Global Health Workforce Network. I would like to see you take some actions which maybe you may not agree, but let's talk about this. I would like us to go back to Goa. I see that the network as it is created now, it reports to WHO. But WHO has got limitations. WHO can't speak out against these people who have alternative facts as their way of influencing the world. I would like us to go to a situation where we have an institution which has the ability to speak truth to power without fear or favor. The way we are now as global health workforce leadership, we do not have that institution because your network reports to WHO. The department in WHO should be there, but we still need another institution with a voice independent of WHO, which can provide that leadership and that voice for health workers. And lastly, third, Ben, I would like to call upon you to request you convene this meeting, or we convened it together, but under your coordination and leadership, let's follow up what we have talked about today. Let it not end in a report which will just gather dust. Let's make an action plan to cause the realization of the resolutions and the agreements that we have made today. I thank you for the opportunity to speak to you and for engaging us at Archist. And I wish everyone a great day, a great evening, wherever you are. And let's continue with this dialogue in other fora. Thank you very much indeed, and bye for now. So, Ben, are you coming back again? Or Claudia, is the meeting over now? We leave?
Francis, I'm unsure as well.
I think it is Ben.
Looks like it's over.
It's over. Yeah, he has gone away. Okay, thank you very much once again for participating. I've enjoyed the whole day, and we continue the work.
Thank you very much for your words. Bye bye, and a pleasure meeting you.
Okay, bye bye.